Good morning, everybody, and thank you for joining us for one of our
Just 1 second.
LGBT
It's now, yeah. Sorry.
Thank you for joining us for one of our LGBTQ celebratory webinars. Today is slightly different. We've needed to pre-record this session with Jenny Ann Bishop. Really pleased to say Jenny Ann's going to be talking to us about the older health and social care needs of trans people. So really interesting and important topic. The only difference with today is that because it's pre-recorded, there won't be a chance to put Q&As into the chat. However, if you would like to email Eva or myself with questions, Jenny Ann has kindly agreed to answer them, and then we will circulate any answers that come back. So enjoy today's webinar. Thank you very much. Over to you, Jenny Ann.
Good morning, Anthony. Thank you for the invitation today, and I'm very happy to give this presentation. And I just want to say that the presentation will be circulated as a PDF because there's a lot more information in this presentation than I'm going to present. So lots of information there for you to look at. I'm Jenny Ann Bishop from the Unique Transgender Network in North Wales, and today we're going to talk about caring for older trans and non-binary people. And by trans, we're including the full spectrum of people whose gender identity is different to the sex they were assigned at birth. So it includes all gender diversity. Next slide, please. This is just a quick one to say who I am. I'm the chairperson for Unique, and I also work with some of the statutory bodies and with a number of service organisations. And in this context, we have done some research projects with the University of Swansea and Age Concern and Age and other charities on health and social care of older trans people. Next slide, please. Most health professionals unfortunately don't have the necessary knowledge about trans people's identity, their gender diverse bodies, and by that I mean a lot of us who've had medical intervention will end up with what I call mixed gender bodies. So you have to think about healthcare for both genders, not just the gender we're now living in. And too unfortunately, sometimes we get abuse from our own LGBT community, which is really sad. Next slide, please. This one just shows the principles we use here in Wales in terms of looking after people in the various health systems, and I'm sure you're all familiar with these. Next slide, please. Okay, in 2018, the UK government did what was then, and I think still is, the largest ever national LGBT survey, and there were over 108,000 responses. So a huge amount of data was generated, but unfortunately, out of those 108,000, only 6% were 55 plus, and bearing in mind we often take older as 50 plus, that's an awful lot lower than the actual population that's 55 plus, which is around 20.5%. Of those that responded, 13% identified as trans, 6.9% as non-binary, 3.5% as trans women, and 2.9% as trans men. And that 13% is in line with assuming that the trans population is between 1% and 2%, and the LGBT population is around 8%. But still, very much underrepresented, and that seems to be the case, that it's quite hard to get data on older LGBT people. Interestingly, and again sadly, trans people had lower scores than cisgendered LGBT people on their life satisfaction. They felt that accessing healthcare was really difficult, with 21% saying their specific needs were ignored or not taken into account. And they had particular difficulty in accessing the specialist gender identity services. Next slide, please. And this just shows the statistical population distribution for you. Next one, please. So what about older trans people's lives? Up until now, there's been very little research done. That has been done has mainly been conducted in North America and in Australia, and there's some good references you'll find in the resources list at the end of this presentation. And too often in research studies of LGBT people, trans people are hidden in the LGBT responses. And as long ago as 2012, a really good study on trans mental health showed that 65% have experienced worries about growing old. So we've known for almost 10 years that there is worries within the UK trans community about what happens when you grow old. Next slide, please. And the research I want to talk about is the TRACK project, Trans Aging and Care, which we conducted into the lives of 50 plus trans people in Wales. And we also, as well as looking at the health and social care needs of older trans people, we looked also at the attitudes and perceptions of the health and social care professionals who would care for us in later life. We also were involved in a project with Age Cheshire and Chester University on older people's experience in the NHS system in Cheshire around the same time as we did the TRACK study in Wales. Next slide, please. Okay, so that's the study and the link, and there's some good resources on that website if you want to look into additional support. And you can see there were a lot of collaborative partners in that particular research project, particularly the University of Swansea's Ageing Centre and the University of Bristol. And of course, our own group, Unique, because within this project, we recruited and trained trans people to be the researchers. And I think it's very important if you're exploring a minority community to have that real buy-in and involvement from the community members themselves. Next slide, please. Okay, so these are the aims and the methodology. We wanted to identify the health and social care needs of older trans people in Wales, and we did that in two-part interviews, which were conducted by peer interviewers, people from the trans community. So the interviewees felt comfortable with the people they were talking to. Researcher from the University of Swansea was there, and we also had backup from counselling and support in case any of the stories and the information that was given really impacted the people being interviewed. We also did a big survey to examine the attitudes and perceptions of health and social care professionals towards older trans people, and we put that together with, and unfortunately the toolbar is masking the end of my slide. Next slide, please. So what were the key findings? Firstly, those of the practitioners. We found that those who did respond had some trans awareness, but it had come mainly from the media, and although they were generally supportive of trans rights, there were big gaps in their knowledge. Over 2/3 said they had no training at all, and the majority of the respondents were white and cis female, so not exactly representative of the community they were trying to serve. Next slide, please. Okay, in terms of the trans people's feelings, they felt that GPs provided a crucial entry point, as they do, to gender-affirming treatments and pathways, and their lifespan healthcare as well. But in general, GPs are inconsistent allies for trans people, both in Wales and in England. And we often hear people who go along and ask their GP to refer them to gender support services, being either told that doesn't exist, we don't do anything like that, or in spite of the fact they can be referred direct to gender identity clinics in England or the Welsh Gender Service in Wales, being sent off to mental health, because in the past that was what happened and the GPs haven't caught up. So there were really mixed responses from the GPs, and there were sometimes instances of discrimination, blocking and being misgendered by GPs and other healthcare staff. Next slide, please. And amongst the people we interviewed, there was a great diversity of experience of aging and differing concerns about getting older. Some people were seeking to transition later in life because their marriage had ended, or their partner had died, or families had grown up and they felt now it was their time. And they had, in the major part, waited till this later point in life. And older age, for them, in a way, brought new opportunities, but also the concerns about getting older and exactly how they will be treated in the healthcare services. Next slide, please. And also, of course, trans people face a number of social and family challenges as they supported loved ones themselves. And very often, it's very hard to emotionally support your family when they're trying to adjust to your change in gender identity. We agree it's hard for the families as well, but quite often we could do with a bit of support, and that's partly what the support groups do. And they found that sometimes trying to manage the sharing of information was really difficult. And because of interventions from all sorts of areas, including healthcare, they often lost control of the information, which was really sad. And too often there were other things going on. People were outed, people were gossiped about, and it all shows really a lack of proper training and understanding. Next slide, please. And as we've said, lots of trans people find it very difficult to navigate the NHS pathways, and too often local healthcare staff are not aware of what the current pathway is, and therefore were not really able to give support and good guidance on how to navigate the pathways. They felt that there were far many hoops to jump through. There was a lack of knowledge about trans healthcare, both at the local and sometimes even at the specialist service level. And there was a real reliance on trans people themselves, their peers, both in groups and in online groups, to give them that support and guidance. And I can tell you, it's pretty tough when you get calls almost every day asking for support in that area, and you hear some really difficult stories. Next slide, please. And as we've said, their experience of the gender services were really mixed. Some are really good, but some have such long waiting times and too often cancel appointments at very short notice. And there were huge delays after appointments in communicating back both to the trans person and to their GP, even when the clinic was asking for shared care with the GP and to, for instance, start providing hormones. It could take up to 6 months for that letter to reach the GP surgery. And of course, because the clinics are widespread and are often not close to home, there can be a lot of expense and stress in traveling to a clinic a long, long way away. In the past, there wasn't one in Wales, so everybody had to go to London. We now have one in Cardiff, which seems to be working pretty well. And of course, in these times, it's providing care via telemedicine, and that works really well with the new clinic. Next slide, please. Okay, at a similar time, the Centre for Equalities and Human Rights in Wales did a survey on the attitudes of surgery staff to trans people and with trans people on how they felt they were treated within GP surgeries. So here you can see again, very similar results to our survey, with a lot of people feeling not at all confident they could look after trans people in terms of their trans-related healthcare, a little bit better when it was looking after general healthcare. But again, a lack of knowledge, and I suspect a lack of any awareness training. Next slide, please. And again, trans patients themselves finding in some cases 57% rated their trans-related healthcare as poor or very poor, and only 14% saying it was good or excellent, and 40% experiencing some form of trans-related discrimination, some really awful. One person related to me, the doctor asked for a blood test, and the practice nurse, when they saw who it was, ran out of the room shouting, "I'm not dealing with that thing." So really awful discrimination in some parts. So it's not surprising that almost half of those interviews said they avoided going for healthcare at their surgery or their local health centre because of a fear of discrimination. And that often means they don't come for medical attention until a problem has got really serious, and in some cases too late for them, and it can end in loss of life. Next slide, please. Okay, and these are some of the stakeholder comments. I'll not read them all. You can look through them on the presentation when you get it. But I think really telling, the first one, the day I need a care worker is the day I implement my end of life plan. How awful that people can think it's better to end your life than engage with the health services. I feel growing old on my own and being denied the right to be me and to meet other trans people. Next slide, please. And I think this first one is really good. It is really important that training on trans awareness is made available to staff in residential homes, hospitals, social and care workers, contractors, really everybody who is dealing with you in health or social care. And one that really chimes with me, I don't want my body to be seen as an embarrassment. And it was one of the reasons I had my gender confirmation surgery, so that in older life, I didn't look out of place and didn't get discriminated against. Next slide, please. So what are our recommendations? Increase knowledge and trans awareness amongst GP surgeries as the point of entry to healthcare and healthcare workers. And we're beginning to now do training at foundation level. So for instance, we regularly provide training to the foundation doctors at the Countess of Chester Hospital and others. Having local gender services, and that's really started to happen now with the Welsh Gender Service, with Sea Magic on Merseyside, Indigo in Manchester, and 56 Dean Street Tea in London. So one of those recommendations really being followed through. And the way that these services work so well is because they have both collaboration with the community stakeholders in setting up the service and the ongoing running of the services. And that collaboration between community and the health services really does result in a much more patient-focused and understanding and supportive service. And there are whole areas where there are better standards of care needed, and you can read through all of those different ones, but particularly in things like record taking and in making sure that a person gets the right cancer screening. So, for instance, although I'm registered as female and get my breast screening, unless I ask for it, I don't get AAA screening at the right time. Next slide, please. And we need to make the onus shift from trans individuals educating GPs and other patients to the services taking trans at the heart of things, as I indicated in the setting up of the service. And we really do need to have both pre and post qualifying training to have proper ongoing training as the services and techniques advance. Next slide, please. And one of the things that we hear all the time is people don't have the right information. So it's really important that information is spread widely and is available through things like GP practices, libraries, NHS Direct, community spaces, and support groups, and wherever really people get information on health services. And to help all of this, we need, as always, to have some increase in resources, and particularly in trying to support the community groups and its networks. Next slide, please. So the outcomes from our track project, there are digital stories online on our website, and you'll see the links to those in a moment. We've produced information sheets for health and social care professionals, and we've put together patient information packs that can be given to people at the start of their trans journey so they understand the right places to get information. Next slide, please. Yes, these are the links to our online films, which we did in collaboration with a trans film company called My Generation, because again, we wanted to involve the community completely in all the work we did. Next slide, please. And we also collaborated with Public Health Wales to produce booklets, videos, and frequently asked questions on health screening for cancer screening for trans people. And I was delighted the other day, my GP sent me a copy of the brochure I'd helped to write. Really pleasing. And Public Health Wales have asked us, and we're busy updating it because it's been so successful. And there is a similar booklet available from NHS England. Next slide, please. There is also, excuse me, there is also a very good booklet called It's Just Good Care, and there are links to that in the information. That just tells you about how to give good care, how to treat trans people. Next slide, please. And this is one of the outputs from the track project on indicating how to provide dignified and inclusive health and social care. And again, that's available in the resources links. Next slide, please. And the ways forward are, we have to work systematically, and I'll not go through all the points. We have to make sure that the third sector, the stakeholders, the people who are wanting this care, are completely involved in true co-production. We need to make sure our care is person-centered, and we need to be working with the clients and making sure we understand that there are differences with different minority communities, and the trans community is no different in that respect. It needs to be listened to and understood, and being pragmatic when we need to, and to be really careful about reflecting on what you're doing, how you're looking after your trans service users. Next slide, please. So our final summary is we're likely to see an increase in the number of gender diverse people accessing health services, because not only are more people coming out, but there are more people because there is more information now in the media and particularly online, and people feel more empowered to be out. And as we've said, this is a vulnerable group with some very understandable fears. Imagine, for instance, if you are an older trans person and you are overcome with dementia and forget you've transitioned. Can you imagine how distressing that is when you're thinking now, oh, I'm not supposed to be out. Why is my body changed? At the moment, the information is fairly sparse, so we do need to do more research. And I'm pleased to see there's a big project going on at the moment called ICTAR, Integrated Care for Trans Adults, and that's exploring all sectors of healthcare, including older people, and to really make sure our systems do model person-centered care. Next slide, please. These next slides are the references. If you'd just like to slip through those quickly, please. Keep going. There's a list of further reading. There is some really good further resources. I can recommend, if you go to the next slide, please, the Transgender Healthcare Guide that was written in a collaboration between the community and one of the gender identity clinics. If you want one place to go, this is the book to read. Next one, please. There are trans health fact sheets available online, and this is the one on older care, and that's one we collaborated with GIAS and the LGBT partnership in writing. Next one, please. This is a really good guide from America on providing services to older trans people. Next slide, please. And this is the best source of information on dementia and transgender and intersex people. Excellent piece of research and a really good survey of the literature available up till then. Next one, please. And this is a book which we contributed to the trans chapter on LGBT and dementia. Next slide, please. And you can just slip through these. There are some really good guides around from the UK on dementia and LGBT. Keep going. Okay, and there's just stop there. There are 2 good guides from the NHS on end of life for trans people, and the next one, bereavement for their friends and family. And again, an area that's greatly unresearched and not very well represented in the literature. Next one, please. Also, we collaborated with the Diversity Trust in Bristol, and they've put out some really good resources. Next slide, please. They've made short films like us, and again, they're useful to look at. they cover the full spectrum of LGBT plus, and there are really good case studies, and we contributed to one of those. Next slide, please. And they provide top tips on promoting inclusive and equality healthcare and things you can do to make your hospitals and care homes friendly for older LGBT people. And there's some good stuff on the legal status in England and Wales for supporting older LGBT people. Keep going. Next one, please. And I just wanted to slip this one in the report on the effect on LGBT people of COVID. And there was a really important comment from one of the trans respondents talking about the fact that because they have to be at home all the time and they're not out, there is a huge strain on their mental health and their themselves in trying to pretend to be somebody they're not at home. Next slide. And again, I'll leave these for you to look at later. These are just some of the effects on healthcare. And finally, I've put in a set of guidance rules for making health and social care providers LGBT age friendly. And again, I'll leave those for you to look through at your leisure. We adapted them from work we did in Wales with age and the work that Age Scotland did in this area. So if you could just slip through those quickly, please, Ivo. Those are the two brochures we adapted from and added some extra, but these are both LGBT and more focused on trans. Just go through the next few slides, please. Yep, keep going. Okay, and that's my last slide. That's contact details if you would like to contact us. And I'd like to thank you for attending and for the invitation to present today. And as I said earlier, you should receive a PDF of the whole presentation so that you can check out all of the resources. Thank you.
Thank you very much, Jenny, for the great session today.
Yes, a bit of a rush.